So the last thing is that the human spring is integrated into the movement pattern. So if it's not working right, then the movement pattern, the engineering isn't right for the human body. So it gets in the way of the healing process. If you're having trouble getting, somebody relief from a herniated disc or from a back pain, and you're wondering why, it's probably because your application is only to the back. I had this one celebrity who was very famous, and he said, Dr. Stoxen, they called me through my agent, said, would you come down to this auditorium and take a look at this man? He's going to quit the group, and he's 25 years as a famous entertainer. And I said, okay, I already know what's wrong with you. He said, I haven't even sat down with you to do a history, and you didn't examine me. How can you tell there's something that you know everything? I've heard everything. I said, your human spring is locked, and I can see why you're not healing. And it'll take me about 2 days to about 15 hours to be able to restore it, but after that, you should be okay. And he looked at me like I was nuts. And anyone would think, you got to be crazy. But my evaluation was done as a gait evaluation. I evaluated his gait, and he thought I had ESP. I said, how come, what about the pain in your right knee? What about the pain in your right hip? What about that? And he goes, how do you know? I said, I know because of this, and I explained it to him. And then after that, he decided to write a book about the experience because it was so remarkable that he had spent this fortune on telling doctors what was wrong with him, and they were addressing this pain by treating the area of the highest amount of inflammation rather than restoring the spring mechanism. And he said, when are you going to work on my back? This was after about 4 or 5 hours of this work. And he got up. I said, maybe you can work on it after the show. And he got up and he said, my pain is all gone. How did that happen? You never touched my back. And that's because what I did was I didn't treat his back pain. What I did was I restored the human spring mechanism, and the back heals itself. You have to remove whatever's interfering with the healing process. By restoring the human spring mechanism, the body can heal itself. That was what was getting in the way of the healing process. And that's what I do with every single patient.